Hey everyone, before we begin, please take a moment to complete our pre-evaluation survey to assess your current knowledge of perinatal substance use disorder, or PSUD. Grab your device and scan the QR code on the screen. If you're having any trouble accessing it, please let us know at projectcareforher _ on Instagram, and we'll give you guys a minute to complete it. As you follow along with our presentation today, please also answer the questions on the post-evaluation survey. This will help us accurately measure what you've learned by the end. Moving on. Hello, everyone. I'm Evelyn Pham.
I'm Lauren Park.
I'm Kathleen Vo.
And I'm Chloe Lowe.
And today we'll be presenting our presentation on care, not judgment, perinatal substance use disorder for our host event, the Emotional Wellbeing Challenge.
Firstly, to understand why PSUD needs attention, we first need to look at the scope of the issue. From 2010 to 2017, opioid-related diagnoses at delivery hospitalization rose by a shocking 131%, showing just how dire the PSUD crisis has truly become. Behind this statistic is a pregnant woman in a hospital bed, often scared, often judged, and often afraid to ask for help or treatment. Perinatal substance use disorder is not a moral failure. It's a treatable medical condition. And today, we're here to go deeper into why that distinction can save lives. Now we're going to direct our attention to the two graphs on the screen here. On the left is a line chart showing the admissions for pregnant women reporting any marijuana usage from the year 1992 to the year 2012. It's a positive trend showing how increasingly dire this crisis has become. On the right is a table showing the estimated number of births in the United States exposed to potentially harmful and toxic drugs. Firstly, we have alcohol, which has been exposed to 390,000 births, then tobacco with 300,000 births, then illicit drugs with another 300,000 births, and then lastly, prescription opioids, which has affected upwards of 240,000 births. With that in mind, let's start by defining what PSUD really is.
PSUD stands for Perinatal Substance Use Disorder. Perinatal refers to the period from pregnancy through 1 year postpartum. Substances commonly involved include prescription drugs, alcohol, tobacco, illicit drugs, and opioids. Substance use during this time period can lead to serious health consequences for both the mother and the child.
Understanding what PSUD is also means understanding how deeply it affects mental health. Pregnancy and early motherhood already bring significant emotional changes, and PSUD can both cause and worsen them. About 30% of mothers with PSUD screen positive for depression during pregnancy, and 40% experience symptoms postpartum. Opioid and tobacco use are strongly linked to depression, PTSD, and anxiety. Alarmingly, 20% of postpartum maternal deaths are associated with PSUD, many of which are preventable with timely care.
But mental health is only a part of the bigger picture. For pregnant women, PSUD impacts physical health in two major ways: increased risk of infection and poor nutrition. Many substances, particularly opioids, are commonly consumed through needle injection, which significantly increases the risk of contracting other infections such as HIV and hepatitis. These infections weaken the mother's immune system overall and endanger the developing fetus through preterm birth, low birth weight, and stillbirth. Additionally, substance usage often disrupts normal eating patterns by suppressing appetite and altering cravings, leading many pregnant women to rely on quick, inexpensive, and highly processed foods with little nutritional value. As a result, both the mother and the growing fetus may experience malnutrition, further increasing the risk of pregnancy complications and adverse birth outcomes over time.
Because a mother's health is so closely connected to her babies, these physical and mental impacts naturally extend to fetal development. One major concern is intrauterine growth restriction, or IUGR. This occurs when a fetus receives insufficient oxygen and nutrients, leading to low birth weight. IUGR is categorized as either asymmetrical or symmetrical, and in both cases, it can increase the risk of structural birth defects, affecting the heart, limbs, or brain. Asymmetrical IUGR typically develops later in pregnancy, where the head is normal size but the body is small, while symmetrical IUGR often begins earlier and affects the entire body proportionally. PSUD also increases the risk of preterm birth, meaning delivery before 37 weeks. Organ systems may be underdeveloped, which will require immediate medical support. These infants face higher chances of SIDS, miscarriage, and stillbirth, highlighting why consistent prenatal monitoring is so critical.
Given these serious risks, the question becomes what can be done? Effective support includes adding more screening in the obstetric department by having psychiatrists and addiction specialists in the setting. Having them around can help mothers feel safer when talking about their substance use history. Treatment options include cognitive behavioral therapy, or CBT, and medication assisted treatments that reduce cravings for alcohols or opioids, as listed on the screen. CBT focuses on identifying underlying causes of substance use, improving communication skills within personal relationships, and developing relapse prevention strategies by recognizing triggers and planning healthier responses.
Now, you may be wondering why PSUD matters to you. PSUD doesn't just affect pregnant individuals. It impacts infants, families, and entire communities. Increasing awareness helps reframe substance use as a health issue rather than a moral failure, reduces stigma, and encourages early intervention, ultimately improving outcomes for everyone involved.
Despite the availability of effective treatments, many pregnant women still struggle to access care. Although screening through questions and assessments is a critical tool for identifying PSUD, it is often inconsistently implemented across healthcare facilities, making early identification increasingly difficult. Additionally, many healthcare providers report discomfort or insufficient training when treating perinatal mental health and substance use disorders. These gaps in training and screening are compounded by limited access to specialized care, as only 13% of substance use treatment facilities and just 7% of hospital inpatient programs offer services specifically tailored for pregnant or postpartum women, creating significant obstacles to receiving timely and effective treatment for PSUD.
Beyond structural barriers, stigma plays a powerful role in preventing care. It can come from healthcare providers, the public, loved ones, or even internalized self-judgment. This stigma creates shame, lowers self-esteem, and reduces treatment engagement. When individuals feel judged rather than supported, they are far less likely to seek the care they need.
And this is where education becomes essential. Even if PSUD doesn't directly affect us, learning about it helps dismantle stigma that prevents families from seeking care. Choosing to understand instead of judge replaces shame with solutions and empowers us to protect not just one future, but many others' futures.
For me, as an aspiring future dermatologist, learning about PSUD will help me to properly pinpoint visible changes that can show up on the skin in mothers who may be experiencing PSUD. Understanding this disorder allows me to recognize these patterns without judgment, choose pregnancy-safe treatments, and create a trauma-informed environment where my future patients will feel comfortable. Ultimately, this awareness supports more holistic care by addressing not only skin conditions, but also broader factors affecting pregnant patients as a whole.
As a future health professional, researching PSUD has taught me the importance of checking my own biases before getting to work with patients. Creating an open space for patients to be honest and feel safe is important in delivering life-changing care. By listening first instead of making harmful assumptions, we can be an advocate for care that treats the whole person, not just the condition.
As a future healthcare professional, some of my biggest takeaways is to make sure my patients are readily informed of the future they could have that comes with their condition and to create a friendly environment with my patients to help them be more open to me. I think it is very important for there to be a strong bond between patient and healthcare professional because patients are entrusting their life with you. Helping others is the job. Being able to educate patients and foster a healthy environment can make the process much smoother.
For me, my key takeaways were that empathy and active listening truly matter, as human connection can also serve as medicine. Providing early support and advocating for patients, especially those without a voice, can create positive change.
Perinatal substance use disorder is preventable, treatable, and deeply human. By choosing education, empathy, and advocacy, we can reduce stigma, improve care, and ultimately save the lives of countless mothers. Thank you for listening, and if you're interested in learning more, follow Project Care for Her _ on Instagram.